Hi, let's chat about the use of dermal fillers in gynecology and aesthetic medicine. I think of these in two categories. The first is where a filler material called Bulkamid can be injected under local anaesthetic by a gynaecologist, and that helps to treat the symptoms of stress urinary incontinence, where you lose urine if you cough or sneeze or jump. I had this done last week and it's been really effective. It can last 7 years or more, and it can work in up to 95% of women with stress urinary incontinence. If you have symptoms, see your GP for advice. The other is a condition we call genito-urinary syndrome of menopause, and that's where the vaginal and vulval tissues change over time. They shrink and deflate. We lose estrogen, we lose collagen and elastin, we lose hydration and lubrication. And the tissues change and become less resistant to friction. Sex can become uncomfortable, you can be drier, urinary tract infections are more common. And the simplest treatment for this is vaginal estrogen. This is a little pessary that you use vaginally. It's not absorbed into your bloodstream and it's really safe and effective. Again, talk to your GP. If you still have some loss of hydration and loss of elasticity, you can have injection of a dermal filler material called hyaluronic acid into the inner labia, the labia minora, or the outer labia, the labia majora. Now, some women in menopause will say their labia, particularly the inner labia, disappear. They don't disappear, but they shrink and deflate and get thinner and more transparent. The blood flow reduces and the colour can become paler. And if you've got symptoms related to friction and loss of hydration, you can have hyaluronic acid injected. It's called a labial puff in the outer labia. These are really important to distinguish between a medical reason and an aesthetic or cosmetic reason. We don't want to say to people your vagina or vulva should look ideal and conform to a certain aesthetic. I was a GP for 25 years and I've done probably over 25,000 intimate exams, fitting Marina coils, doing smears and the like. And our anatomy varies, and that's the way it should be. This is not a question of saying you need an ideal full vagina and vulva. It's just saying that if you have symptoms and you want a solution, see your GP or look for specialist advice. There are treatments out there. We shouldn't suffer in silence. We've got lots of changes happening to our body, and we've got a long lifespan ahead of us beyond menopause. If you have symptoms and you're concerned, seek professional medical advice. Do get in touch if you have any questions. Take care. Bye.